So the question I was asked is really about the role of patients and patient organizations in what we think will be the next generation health system. So there's no certitude at all about what it will look like. And frankly, we just said that we've made some great progress when it comes to telehealth, but we're seeing some drawbacks already. We're seeing physicians wanting to go back to in-person visits because this is their comfort zone. So instead of trying to be thorough, I kind of wanted to embark you on my dream. The next generation health system, for me, this is what it looks like. So first of all, they're digitally connected with the population they serve. And connected doesn't mean necessarily communication. One-way communication is fine. Two-way communication is definitely better. But if there can be a link that actually sends my data to the health system, it's even better because I don't have to speak about it. They have the raw data. The second point is that empowered and engaged patients are part of the care team, and they have their word to say in shared decision-making, which becomes the rule. We should not take decisions for patients and their families. They should be making these decisions. And we know that healthcare professionals are making a good job about always saying, it's your final decision, but frankly, from time to time, we feel stirred in one way or another. And one thing, I may be the vice president for content at HIMSS, but I'm also actually an asthma patient. It's a moderate asthma. I think I was only admitted once to a hospital because of it. So it's something that I can manage and something that I have to remind myself, in the morning, it's that medication. In the evening, it's the other kind of medication. And if you can see from my background, I have moved to a sea town that I think Shane knows very well. And it has aggravated my asthma. So it's something that I'm really being very careful about. So in this next generation health systems, my dream is that people or patients are people, not failing organs. What we know is that medicine has been very segmented. They've become very specialized. And when you come to them, you are a pancreas, or you are a liver, or you are a set of lungs. But rarely do they see the patient around all of this. And that's really including mental health. A lot of conditions are coming with mental health issues. I think in the case of degenerative diseases, as many as 70% of the patients suffer from depression or any other kind of mental ill. And that's not okay. That is not okay. We should be better than that. In my dream also, the primary, secondary, tertiary, mental and social care are integrated, and digital patient records enable care transitions with the highest standards of quality and patient safety. What does that mean? It means that usually your GP has a care record. The hospital that has been treating you has a different one. And if you had a very specialized meeting with tertiary care, then it's in a different silo. And then, mental and social care, we're getting there, but they're definitely not, part of your personal record. We're starting with an EMR or a patient record, I want to call it, because EMR, EHR, just terms for the primary care physicians. What I want to call it is a patient record. And it doesn't mean that it belongs to the patients, but at least he or she has access to it. So in a perfect world, all of these dimensions, including social determinants of health, are all making sense in one record. And that record is always available to the extended care team. And that includes patients, caregivers, families, people who maybe were asked to make decisions on behalf of the patient in some cases. In that next generation health system, hospital admissions are the exception. We know that patients want to stay at home with their loved ones as much as possible. And we also know that hospital admissions are very costly. So we're trying to fight two battles here. So hospital admissions should really become the exception, not the rule. And then in my dream, data would drive decisions. With AI helping to reduce clinical variations. I live in Spain now, and I still have to discover what the healthcare landscape is like. But in France, it's very simple. If you are in Paris or in Lyon or in Marseille, you're in the best hands. You have the great professors, and then you have the great interns who want to be close to the, renowned professors. If you happen to be in a different region, you're kind of out of luck. And I'm hoping that clinical decision systems will help reduce these clinical variations. It's not about AI replacing doctors. It's AI assisting doctors, and especially the ones that are not, top of their class. Because there's something that we rarely talk about because we're trying to be very respectful with doctors, but frankly, doctors are not equal. They're not. And if you've been a patient, you've either been lucky or you've experienced that. And then the last point is the fact that precision health finally happens. And precision health is very different from precision medicine. When we talk about precision medicine, we talk about treatment. When you talk about precision health, we talk about using multiple sources of data. And I know it comes with its, consent problems. But we also know that patients are happy to use this data if it helps them or people with the same condition. So we shouldn't hesitate, because the point is to personalize health and care plans and treatments, but also take a lifelong approach of citizens' health. And nearly, I would say, from their birth. And then shift the balance from acute to preventive care. So this is an idea of what happens in the patient, a chronic patient's life over a year. So here you have is, sorry, maybe, yes. Here you have is ups and downs. And it's true for very many conditions. And these are the interactions that he or she has with his doctor. It's rare. It's 3 hours per year, which means that 57 hours of the year, he's on his own. He may be surrounded with good people. He may have the technology, but he's separated from his health system. So the idea is to blend the approach, really. So that all these blue lines here are the technical support that we can provide. And I describe it as a blended approach because it's not just digital. It can be just digital, and we know that it can be, in-person consults either, whether they're by phone or telemedicine. It's not possible that your doctor will follow you day by day or month by month, but technology can. And then you can report on what's happening to you during these variations. I think it's very important. I mean, I know we're talking about long conditions, but if you take the extreme example of someone with manic depressive syndrome, then, if that doctor appointment happens here, at the height of, where he's well, then the doctor will ask, how have you been in the last 6 months? And the patient will respond, it's been great, awesome, nothing to say, because he is at a high. If you ask him the same question here, he's going to tell you, oh, the last 6 months were awful. We're not good at memorizing what happened to us throughout the year. Unless you hold a journal where you write everything down, you can sign everything down, we're not good at remembering what happened during the year. So these 3 hours spent with the health professionals are definitely not enough. Here I'm going to be very, very quick, but I wanted to, and I will share this presentation if you want to see it, but I wanted to take an example in oncology, where really digital health can help from prevention to early diagnosis, to treatment, to patient support, to survivorship, and then make a link to research. So I will let you read that on your own time. But basically, although it's not a term that I like to use, patient-centered health, I think it's, I don't know, I don't like it. We can talk about it. But people are getting more toward the center. And then everybody wins. The values of the patients are taking into account. His or her idea of quality of life is taking into account. His support system is taking into account. And the result is really that we have improved patient experience, better health outcomes. And we've discovered that actually the staff I don't know if you are aware of that, but there's a physician burnout phenomenon happening at the moment, which is pretty scary, especially after COVID-19. So if we can improve their experience as well as the patient experience, it's a big deal. And then it is lower cost of care. We know that one of the problems that we've had is not making ends meet. Our social security systems are costing more than what we receive in compensation, and we need to change the model. And I think putting the patient at the center, or reorganizing services around patients is the way to deliver value-based care. Nope, sorry. So I think the conclusion is that your health is now in your hands. And I like this, this visual because it really shows a hand. With a link to primary and secondary care, with a link to laboratory analysis, with a link to at-home diagnostics. And I think this is what we need to look forward to. So what does it mean to be in the center? That's a new role for patients. And maybe we're not at the same level when it comes to preparedness of taking that role on. First of all, from a passive order takers to active team members, that takes a leap. And it takes a leap for patients, but also for physicians. They need to understand that a different conversation needs to happen. And this is an area where we can help them. I want to say also, claim your data. And I want to highlight the fact that it's not about ownership. Ownership, the word, has created more problems than it has solved any. So it's really about access. If you have access to your data and your care provider has access to your data, we're all good. Nobody needs to own it. We talked about the different care settings and the care transitions as sensible areas where information can get lost and quality and patient safety can be, in danger. Be the active link. Build the bridges between the different care settings. Then engagement, maybe I should have put that one first. But it's about doing your part. You're now in charge of your health, or at least you're in charge of co-producing your health. So self-management, treatment adherence, PROs, if you're using digital technologies or not, these are things that you should do. You cannot go back to your physician and say, yeah, it has degraded, but I haven't taken anything and, it's not been a good year. You can't say that. Self-management becomes a real important point of the discussion. And then I think there is a role for patients to support and educate other patients. This is a big question for me. We always do conferences where patient experts or enlightened patients make keynote presentation, and we're all like, wow, yes, this is great. But is it representative to all the patients you know? It's not for me. So the goal in the future years will be to extend the reach of patient empowerment and patient engagement, because right now it's an elite that speaks at events, and what we need to do is really democratize, for lack of better word. And then the last thing that I had as a role for a patient is you are a consumer. You are the end users. You have a voice. So choose your provider. And if your provider is not okay, change it. If he's not okay trying, new technologies or experimenting with new treatments, you need to change. The world of research is evolving very quickly, and we definitely need to be married to the providers that will actually drive us in the right direction. And then the last question I was asked to answer is, how can patient organizations help? And I think there's very many things. First of all, patient empowerment is not something that happens naturally. So we need to push for it. We need to prompt it. And we need to, when we talk about patient empowerment, we're talking about information access mainly. But as you know, on Dr. Google, you can have this explanation or exactly the reverse. So there is a role of guidance here to the right tools and the right sources of information. This is something that we realized with COVID-19. The pandemic turned into an infodemic very soon, and people were confused. So patient organizations need to put some order, in my book, in what information their patients, their members should be driven to. The second point is build communities, because patient isolation is the worst thing that can happen. Feeling lonely with a newly diagnosed condition is the worst feeling ever. But again, we need to guide them to the right communities, because there are some communities that are pretty scary. If you go to the Facebook pages of lung diseases groups, you will see people who are basically sorry for their lost ones and will make you feel that there's no hope, but there is hope. So communities need to understand that, and I think there is a role of patient organizations in helping them get there. The third point is to care for caregivers. We always forget them. And I'm not sure about lung disease, I don't have the data, but if we're talking about neurodegenerative diseases, it's quite often that the caregivers die before the loved one that they're caring for, out of exhaustion. The doctor will always say, so how is the patient? And will rarely say, and you as a caregiver, how are you doing? So I think this is an important point. I've known too many people who have been diagnosed with something and have stayed with the same treatment for 30 years. So staying ahead of innovation, new treatment, and keeping your patients informed and trying to get them to have that discussion with their clinician is very important. I also think that there's an educational part that needs to happen with clinicians. It's a new relationship with their patient. They have access to a lot of information. The goal is not to fight it. The goal is to make them work for you. So guide them to the right resources. Empower them this way. Don't fight that movement. It's not going away. And then the last one is about co-design. You're the best link between patients and solution providers. You're the best way for them to build evidence. So be there for them. And I guess the most important one is the last one. You can help shape the policies that get us to this next generation of health systems. It will take some work, for sure. Policies take time. But if they're not rattled, nothing happened. So you have a role there. And with this, I think I want to thank you all for having me today.